Hello, friends of Dr. Bicuspid. Listen, today I want to talk about what everybody's talking about, right? Coronavirus. So, one of my favorite quotes from Plato is this. It's the right question is often more important than the right answer. Especially now, right? We don't have all the answers. So my question is, how do we stay professional? How do we stay level-headed at a time when a lot of people in the world are starting to panic? And that's not something we need to bring to the table, right? Because we have chosen a career where we take care of patients. Now, how do we take care of our patients? Stay calm. How do we take care of our teams? How do we take care of ourselves? How do we take care of our families? How do we look at this thing from a professional standpoint? First, we need to know the history, right? Not just of what's going on today with coronavirus as a pandemic, but we need to look historically at other pandemics. And the last one hit the US, well, the last one hit the world by definition as a pandemic in 2009, right? So H1N1. It affected 250,000 people in the world. And you know what, guys? It's 2020. We're still standing. So I don't want you to underestimate what's happening right now, but I also don't want you to overestimate what's happening right now. So as we take a look at all the people that we impact day in and day out, for me, it's all about risk, right? Who's at risk? So we know right now that coronavirus is most harmful to people who are elderly and immunocompromised. So we, in our personal lives and our professional lives, need to be most careful around people who are at high risk. Now, other high-risk situations are what? People who travel, right? That's our risk. So patients who've traveled, or team members or family members who've traveled around the world, and now they're in front of us. That increases the risk. People we know who are in areas where they're getting community spread, which is why right now certain areas are being quarantined to try to encapsulate that spread. But if you come in contact with a person who's from one of those areas from community spread, or you enter a community, then your risk goes up. The third one's one we don't really like to hear, right? But healthcare workers, we're at more risk. Why? We have patients coming to us who are sick every day. In dentistry, very fortunately, much less than physicians who are in ERs or GPs. Patients who are coming in specifically because they believe they may have coronavirus. So we're at a lot lower risk. So my questions for you based on those risk factors are, hey, if you're around elderly or people who are immunocompromised, what can you do to help them better? And if you're one of those people, what can you do to protect yourself? If it pertains to an area where a community spread is happening, do you need to be there? And if somebody's coming from that area, do you need to be around them? Travelers, same way. Do you really need to travel on a vacation now, or can that wait a little bit? And as a healthcare worker, how do we protect ourselves? Are you practicing pristine universal precautions? Hopefully you've been doing this for years already. If not, double back, check. We're prepared, stay level-headed, stay professional. We're gonna get through this. We always do. I don't want you to underestimate it, but guys, please don't overestimate it. We're in a good spot. Hope this helps. Corona's gonna be past us in a few months. We're gonna learn a lot from it. We'll be better off for it. Have a great day, guys.